Interstitial cystitis is called IC for obvious reasons. It's hard to say. It's a bladder condition. So your bladder normally has a lining in it that protects it from acids and chemicals and things like that as your body processes and expels urine and whatnot. Those people with IC, often when they're younger, have experienced bedwetting problems, inability to, how they have to go to the bathroom all the time, or it's hard to go, and a lot of people call it overactive bladder and stuff like that. And the underlying condition may be IC, or it could just be that they have a bladder that likes to go all the time. Hard to tell. The problem with IC is that lining in your bladder goes away. It eats itself. That's why it's an autoimmune. It destroys itself. So no longer do you have any lining to protect those nerves in there, the blood vessels, etc. So anytime you eat something that's highly acidic or the wrong chemicals or the wrong mineral bases, it goes into that bladder and it just hits all of those nerves. And so it's extremely painful. And it'll cause it to spasm, it'll cause it to swell, it'll cause you to need to go to the bathroom really, really often or not allow you to go to the bathroom at all. Stress can help influence it. Any kind of trauma to it whatsoever, not drinking enough, drinking too much. You have to find a nice balance. And so a lot of it can be controlled with diet, like not eating the wrong food. So bananas are out, tomatoes are out, any spicy foods are out, unless it's turmeric. For some reason, turmeric helps inflammation, and it helps. So it's a weird spice that's okay in there. But a lot of your favorite foods and most base foods for everything goes out the window. Pepper, a lot of salt, everything is just gone because it causes pain. And so you eat something and a couple hours later you're in extreme pain, spasming. We call them flares. So if you're having a flare, pretty much you're on saltine crackers and some water and you're sitting in your bed maybe crying for a week. There are treatments for it. The couple of things for like overactive bladder, azo, different things like that help alleviate it because it makes it not spasm so much to have to go to the bathroom all the time. But sometimes those treatments don't work for people. The one way that they can treat a couple of ways, if it's really, really bad, like mine was when we first was diagnosed, is that they go in surgically and go up in and expand your bladder really, really big and then bring it down. And so it's like all the nerves are kind of just deadened for a while, which is like, you think that'd be counterintuitive, but it works for about 6 months to a year sometimes in making the pain not feel as bad. It just tricks your bladder into healing itself for a while is basically what it does. So you hurt for a couple of days, the bladder starts to heal itself, and then it destroys itself again. And it's a cycle. Another treatment is they call it installations. They take and inject up in through a catheter up into your bladder, a treatment of lidocaine and heparin, and sometimes other chemicals that are basically just pain medicine straight on those nerves. And that's what I usually do about once or twice a week. Sometimes I can go in between for a while. Some people can't do it at home, and so they go into the doctor all the time, and if your insurance doesn't cover it, you're left without it. Insurance doesn't cover a lot of these meds because it's not a widely known thing, and the meds are not usually for that treatment. Heparin, it's injected to you usually for other blood conditions, not usually used for going up and just injecting into a bladder. And so a lot of insurance companies don't think of it as an appropriate treatment or appropriate use, and so they don't cover it for it. So that and the lidocaine usually is injected and not used. So they're starting to get better about it. Mine is covered because I have a good insurance plan, but when I was living in California for 3 years, it wasn't, so I was paying cash out of pocket. So you learn to make it stretch, and like, how long can I deal with the pain until it's too bad that I can't anymore and I have to do. It will put you down in bed. It's one of the worst pains. Come to find out, that's probably what's causing a lot of my preterm labor problems, because the stress on my body, the stress on the bladder, and not knowing what it was, having babies put a lot of stress on it that was not known. So my last baby, I was in the hospital on morphine for a week. Couldn't figure out what in the world was going on, checked bladders, checked kidneys, everything else. The whole time it was probably my bladder. And as soon as you have a baby, it takes the pressure off. Pain went away for about 10 years of problems in and out. But it took 10 years later, after having that last baby, to realize what the problem was. Good OBGYN figured that out. So it's pretty painful, and a lot of people don't understand, why can't you eat this? And why are you suddenly going home from church? And you look fine on the outside, but inside it's painful, and you can put on a happy face sometimes, but a lot of people don't understand how bad it can be. And they don't understand what it is, because no one talks about it. Who wants to talk about their bladder? I mean, really, it's like, yeah, I have to go to the bathroom all the time. Sorry, guys. It's just one of those things. I'm lucky because with my work, I can have a bathroom right nearby, and I can leave my classroom for a few minutes if I have to really go and do. But there are days it's like I could live in a bathroom, and it makes it hard to work sometimes. And a lot of people who have it much worse than I do can't get it under control. They've had their bladders removed completely, and they just have a catheter from the outside that they drain every once in a while, straight from things. People are on disability, function at home. It affects relationships because intimacy becomes hard. A lot of husbands have a hard time with the depression and the pain problems that come along with it. I've been lucky. My husband helps, and he's a medical professional, so he helps me be able to deal and get over the problems sometimes, or leave me alone when I need to be left alone. But not a lot of people I know are so lucky. So.